Coronary angioplasty restores blood flow by mechanically opening narrowed arteries.
So it brings us to this really fascinating question, one that millions of families face every single year. How on earth do doctors fix a blocked artery without doing major surgery? I mean, just a few decades ago, accessing the heart meant highly invasive procedures, literally opening the chest and dealing with incredibly long recovery times. But today, the approach has fundamentally changed. Through some truly ingenious techniques, doctors can now navigate the intricate pathways of your cardiovascular system, finding and fixing those life-threatening blockages without ever having to make a major incision. No way, right? But it's true. Right, so the clinical term for this magic is percutaneous coronary intervention, or PCI for short. You'll probably also hear it referred to as a coronary angioplasty. The ultimate goal here is super simple. It's a minimally invasive procedure specifically designed to restore blood flow. You see, when plaque builds up or when blood clots form, they narrow or just completely block the coronary arteries, which effectively starves the heart of oxygen. PCI aims to go in and pop those vital pathways right back open. Walking into a hospital for any heart procedure can understandably be a bit overwhelming, but the actual journey is highly structured. It really just breaks down into 3 clear phases: preparation, the procedure itself, and recovery. Let's look at how that plays out. Okay, first up is arrival and prep. As soon as you arrive, the medical team acts incredibly fast to establish a controlled, calm environment. Step 1, they're starting an IV line, giving them a direct route for any necessary meds. Step 2, you're connected to a heart monitor so the team gets continuous real-time data on the heart's rhythm. And step 3, this one's absolutely crucial. A sedative is given. Now, this isn't necessarily to put you to sleep. It's specifically to help you relax. Keeping things calm and comfortable is a huge part of making this whole minimally invasive thing a success. Now for the main event, the actual procedure. To get to the heart, doctors actually start in the groin, which I know sounds completely counterintuitive, but it provides a direct highway right to where they need to go. First, they completely numb the area. Then, they carefully insert a needle into the femoral artery. Once they've got that access point, they advance this very thin guide wire through the artery, routing it all the way up toward the heart. After that guide wire is in position, the initial needle comes out, and a small tube called a sheath is placed to securely maintain that access point. Oh, and it's also at this exact stage that a blood thinner is given, which is absolutely vital to prevent any dangerous clotting while they work. But wait, that actually leads us to a bit of a puzzle. We know the wire is making its way up to the heart, but how does the doctor actually see your heart without opening your chest? If they're operating from the groin, they obviously need a set of eyes inside the body to guide them through this crazy complex network of blood vessels. Well, to solve that puzzle, doctors rely on a brilliant combination of 3 navigation tools. First, a flexible catheter is guided right over that wire we just talked about, following it all the way to the heart. Second, they use fluoroscopy. Think of this as basically a live action X-ray to watch the catheter's movement in real time. And third, to actually see the blockages in the dark, they inject a contrast dye through the catheter. This dye produces what are called angiograms on the X-ray monitor, literally lighting up the arteries and clearly revealing the exact location of any plaque or blood clots. It's kind of like a built-in GPS for your veins. So the doctor has successfully navigated through the body, they've used the dye to light up the problem area, and the catheter has reached the exact site of the blockage. This is it, the critical moment, the fix. The entire goal now is to compress that plaque and instantly restore that life-saving blood flow to the heart muscle. Achieving that fix is a 2-part solution for a lot of patients. First, a balloon-tipped catheter is perfectly positioned right inside the narrowing of the artery. Once it's there, that tiny balloon is inflated. The pressure of the balloon physically compresses the plaque right against the artery wall, forcing the pathway open and getting that blood flowing again. But to make sure the artery doesn't just collapse back down, actually, scratch that. To make sure it stays permanently open, they often follow up with a coronary stent. The stent acts like a tiny scaffold. It expands along with the balloon, but then it actually locks into position. So when the balloon is deflated and removed, the stent stays behind, acting as a permanent structural support to keep that artery wide open. A real game changer. And just like that, with the blood flow restored and the artery secured, the team initiates the exit and recovery protocol. It's a really swift transition. The temporary tools, so the catheter and the deflated balloon, are carefully removed from the body, while that tiny stent remains permanently in place to do its job. Back at the access point in the groin, a pressure bandage is firmly applied to prevent any bleeding. From there, the procedure itself is totally done, and the patient is moved to a recovery area where they're closely monitored by the team for several hours, just to ensure everything is perfectly stable. After those initial hours of monitoring, the medical team evaluates the patient for discharge. Now, there are generally two possible timelines here, and it's entirely dependent on how the individual is recovering. In a lot of cases, if the early recovery is excellent and complication-free, the patient can actually be discharged to go home on the exact same day. Pretty amazing, right? Alternatively, if the doctors feel the need for continued observation, just to be absolutely safe, the patient might end up staying overnight in the hospital. Both are completely normal outcomes based on what the patient specifically needs. I mean, just think about the sheer scale of what we just covered. An artery blocking vital blood flow to the heart, which is a potentially life-threatening emergency, is identified, accessed from the leg, and structurally repaired from the inside out, all while the patient is awake but relaxed, without a single major incision on their chest, and with a very real possibility of sitting in their own living room later that exact same day. It's an astounding triumph of percutaneous coronary intervention, transforming what used to be this massive ordeal into a swift, minimally invasive medical marvel. It really makes you wonder, what other impossible procedures will we be solving from the inside out next?